this is Ryan, Kelly, and Melissa, and we're here to discuss healthcare-associated infections per the Healthy People 2020.
The Healthy People 2020 goal is to prevent, reduce, and ultimately eliminate healthcare-associated infections. The objectives for this presentation are to understand what HAIs are, including specific examples, explain how they are transmitted to patients, describe the procedures to prevent them, and identify the nurse's role in prevention of HAIs. HAIs are infections that are acquired as a result of exposure to a microorganism in a healthcare setting. These settings can include hospitals, doctors' offices, and outpatient centers. There are approximately 2 million HAIs a year, and there are 99,000 HAI-associated deaths per year. Half of these infections are caused by antibiotic-resistant organisms, and up to 10% of hospitalized patients will acquire an HAI. These infections can be described by the specific organism causing them or by the portal of entry into the patient. Some examples of organisms are MRSA and C. diff, and some examples of portals of entry are urinary catheters and IV sites and central lines.
Before we get into specifics exactly about the hospital-acquired infections, let's discuss the chain of infection. The first thing you need is a pathogen. A pathogen is any microorganism that can cause disease. That pathogen needs a source: food, water, a toilet seat, maybe some buttons on your bed, feces, and respiratory secretions. Then it needs how it gets into the patient, either by direct contact, touching, or indirect, such as surfaces or medical equipment. Then it needs an entry point. Entry points include mucous membranes, open wounds, or tubes like catheters, IVs, and feeding tubes. Next is the susceptible host. Young and old are generally more at risk. They need an underlying chronic disease, such as diabetes or asthma, or a condition that weakens the immune system like HIV. Also, a susceptible host might be taking specific medications that cause them to have immune deficiency, or they might even just have an invasive device that are inserted, for instance, catheters or an IV. Always remember, prevention of transmissible infections is a priority in all areas of the healthcare.
Okay, so let's get into some of these healthcare-related diseases. You have MRSA, which 85% of cases were from healthcare facilities, like Kelly said, doctors' offices, hospitals, nursing homes. MRSA is susceptible to vancomycin, and if left untreated will lead to sepsis. A team of researchers from Columbia School of Nursing in California surveyed infection prevention and control departments of 203 acute care hospitals. They found 77.8% of these patients who have MRSA were transferred from nursing homes. Readmissions, 30 days, was 75.6%. 72.8% were ICU patients, and 63.3% were dialysis patients. So here is a video about MRSA and sepsis.
Do you know about sepsis? Sepsis is a deadly infection that can shut down major organs within hours or days if not treated immediately. Sepsis is a medical emergency. I know from personal experience. My sister Linda, while recovering in the hospital after surgery, became infected with sepsis. And even though doctors told us that it was very serious and that Linda could die, Linda did survive. A year later, my other sister, Kathy, while recovering in the hospital after surgery, became infected with sepsis, but Kathy did not survive. Our best defense against sepsis is awareness and prevention. Never again do I want a family that's what my family and I have. When in the hospital, as a patient or even a visitor, it's so important that you be aware and you have to be safe.
While we take many precautions, healthcare-associated infections are always a risk in any hospital environment. Following the guidelines to prevent infection is the responsibility of the staff, of you, and your visitors. Here's an example of how easily germs can spread and result in infection.
Whitney was a sophomore in college, an excellent student with dreams and goals. She came to be in post-op after having an appendectomy.
Still doing a little bit of everything.
Yeah.
But this IV line still really hurts.
Well, like I said, I can try moving it to the other arm.
Yeah, whatever you could do.
Sure. Is that a rash?
Oh, my cat scratched me a few days ago. I told them when they took my history.
Okay. It shouldn't be a problem if the IV is down by the wrist.
Thanks. Sorry to be such a bother.
I'll be back in just a minute.
Okay.
The probable source of the infection was down the hall. Tom wasn't even supposed to still be there, but he contracted a MRSA infection at his surgical site. His daughter, Kelly, unfortunately didn't understand that even though she was just a visitor, she was also a part of the healthcare team.
Hey, my dad could use an extra pillow for his back.
Okay, I'll bring you one in just a second.
Kelly had been educated by a nurse about the barrier precautions and the dangers of healthcare-associated infections, but she didn't quite grasp how just one lapse can cause infection to spread. Dina? She was a good nurse, but was burned out with stresses at work and home.
I know you're always busy with all the paperwork you're doing, but if you get to us soon.
She wasn't going the extra mile to ensure the safety of patients.
I just need another minute or two, and then I will bring you a pillow, yes.
Okay, thanks.
She recognized Kelly wasn't using her gloves correctly, but didn't use the opportunity to educate, and didn't take personal responsibility for cleaning a potentially contaminated surface.
Whitney's IV still hurts. I'm going to try moving it to the other arm. Can you cover Mr. Daniels for a few minutes?
Yeah, I wasn't going to finish this anyway. Thanks.
An otherwise responsible new nurse was using gloves so she didn't also feel the need to wash her hands.
Oh, that's so much better. Thank you. Let me know if there's anything else you need.
Is it cold in here?
I don't think so, but I can get you another blanket. Okay?
48 hours later, the nursing assistant took Whitney's vitals at shift change, including a temperature of 97 and blood pressure of 90/60. By the time she reached the ICU, she was suffering from organ failure as a result of sepsis. And then...
Hey, Dr. Green. Everyone. The ICU just called me. Whitney from 204, she had a MRSA infection in her bloodstream. She passed away.
The key to preventing a situation like this is to protect ourselves. If the airborne, contact, or droplet signs are posted outside your room, help us make sure that everyone, including staff and visitors, follow the directions when entering and leaving your room. This includes properly using and disposing of gowns, gloves, and masks. By doing so, we can avoid having a hospital visit result in a healthcare-associated infection. For more information on these precautions that are needed during your stay here at Strong, you can check with one of your health team members, or you can encourage your visitors to check in at the information desk. Thank you very much for helping us make the hospital a safer place for everyone.
All right, now moving on to C. diff. 500,000 infections happened in 2011. 83,000 experienced at least one reoccurrence. 29,000 died within 30 days of the diagnosis of C. diff. So C. diff can happen due to prolonged antibiotic use, like we have learned. Also, PPIs. According to MedSurg Nursing, PPI therapy was shown to nearly double the likelihood of C. diff because it shifts the pH in your GI system. Also, C. diff spores can survive on many surfaces for up to 2 years, and many antibacterial agents used in the hospital do not kill the spores. Bleach is the only thing to use against the spores. And washing hands instead of using hand sanitizer, because C. diff loves hand sanitizer. Don't be an enabler. So the nurse's role in all of this for both MRSA and C. diff, and any infection really, is to provide education to both patients and visitors coming into the hospital about transmission and prevention. Use contact precautions such as gowns, gloves, and even masks sometimes. Don't forget hand washing is important, as we all learned from 213. And use alcohol-based sanitizer when your hands aren't visibly soiled, except for C. diff. So, most of us probably haven't really learned this, how to don your PPE. But first, you're going to wash your hands, and then you're going to put the gown on, and any respiratory protection if necessary, any eye protection if you're coming in contact with blood that can spurt. And then you put on your gloves. That's called donning. Doffing your PPE, you start with the gloves first, then the eye protection, then you take the gown off, and then you can take the mask off and perform hand hygiene.
Okay, so another type of healthcare-associated infection is a CAUTI, which is a catheter-associated urinary tract infection. According to the Clinical Journal of Oncology Nursing, 80% of UTIs that are acquired in hospital are associated with Foley catheters. Some reasons that a patient may get a catheter are surgery, the need for accurate I&O, urinary retention, and pressure ulcer healing, among many other things. These patients can develop a CAUTI as a result of poor hygiene or maintenance of the Foley catheter, and also prolonged use of the catheter. It's important to remember when caring for these patients that a catheter is an invasive device, and it is a direct route to the bladder for bacteria. Research says catheters should only be used for appropriate indications and should be removed as soon as they are no longer needed. So the nurse's role in CAUTI prevention is to assess for catheter need daily and also suggest discontinuing the catheter if it's no longer necessary. If the catheter is needed, you need to make sure to keep the collection bag below the level of the bladder and also off of the floor. You need to perform routine hygiene daily and after episodes of incontinence to avoid E. coli from the stool causing a UTI. And you also need to monitor the urine that is coming out for changes which may indicate an infection so you can catch it early. The last type of infection we're going to talk about are CLABSIs, which are central line associated bloodstream infections. Again, according to the Clinical Journal of Oncology Nursing, most healthcare associated bloodstream infections are related to the presence of central venous catheters. These central lines are intravascular catheters which ends in a blood vessel very close to the heart. So if bacteria does get into the bloodstream, it circulates very quickly throughout the whole body. Some reasons patients may get central lines are long-term antibiotics, TPN, caustic medications, and also dialysis. Evidence has shown that the use of CHG bathing has reduced the rate of these infections. This type of bathing may also reduce other infections such as MRSA and VRE, and it also reduces healthcare provider hand contamination. The nurse's role in CLABSI prevention is to always maintain sterility when accessing the central line. You want to adhere to policies and procedures regarding patient hygiene, such as the CHG bathing. You want to assess the site daily for any signs of infection. Always ensure the dressing is clean, dry, and intact, and follow the guidelines for the length of time the central is in place.
So how do we prevent HAIs. First and foremost, and the most important, is hand washing, and we'll get to that in a little bit. But always remember to follow standard precautions. Follow the other types of precautions that are listed outside of the patient's rooms, including contact and enteric and droplet precautions, which was discussed earlier, and specific cleansing when patients have certain devices like the catheter, the central line, and etc. So hand washing. Keep calm and wash your hands. One of the basic steps that everyone always forgets is how to wash your hands. First, turn on the water, wet your hands, soap, palms first, then the backs of your hands, doing in between your fingers and interlocking your fingers. And then twisting your hands around and locking hands again, making sure you get your thumb and the crease at your thumb, and then making sure you get your fingertips as well. Rinsing the water from fingertip to wrist, drying your hands thoroughly with a single-use towel, and turning the faucet off with that towel and disposing of it. Standard precautions are the cornerstone for protecting both patients and healthcare providers from disease transmission and acquisition. Here's a little funny video for you guys.
Oppan Gangnam Style. Gangnam Style. Oppan Gangnam Style. Sexy lady. Oppan Gangnam Style. Sexy lady. Oppan Gangnam Style.
As you can see in the video, it's not just healthcare providers that can prevent. It's everyone that's in the hospital and anyone who could touch anything that comes to a patient. Food, security, doesn't matter. So here's some three case studies we're going to discuss. First is Danielle's story. Danielle's story is kind of a sad one. A girl, Danielle, her mom went into the hospital after a fall, and she went to rehab shortly after. She was in rehab for a short time, and she started to acquire GI symptoms, which got her readmitted to the hospital. 2 days after being in the hospital, she was moved to the ICU and was diagnosed with sepsis and died just a few days later. Her daughter, Danielle, who was visiting, actually ended up acquiring C. diff and having to be admitted to the hospital. She did survive, though. Second patient, RM, it was a female patient who came to the hospital for a hysterectomy. Hysterectomy, she was only supposed to stay in the hospital for 2 days after the procedure. A day after her procedure, she started having flu-like symptoms, and her incision on her stomach started having some weird bruising around it. About a day later, she had necrotizing fasciitis, which is a flesh-eating disease. That was a surgical infection caused by the surgical team. The heart valve replacement patient, Mr. PH, he was admitted to a PCU after his procedure, but shortly after that was moved to the ICU, and 2 weeks later he had passed away. He actually had received MRSA and had septicemia. When they did his final autopsy, they found that he had abscesses in his heart and his spleen. The hospital, which was not a hospital in the United States, actually tried to blame visitors for coming in contact with the patient and getting them the infection, but after that they had found it was a surgical infection as well.
Okay. Okay, takeaway, our favorite parts. So, nurse's role, educate your patients and staying current on evidence-based practices like hand washing and other policies to protect your patients. Follow all the policies and procedures regarding precautions. And most important thing, right next to hand washing itself, is advocating for the patient, because that's what you're there for, is the patient. And protecting yourself too, so you don't take any of these infectious diseases home.
As the CDC puts it, hand washing is like a do-it-yourself vaccine. So it's not only for us nurses and healthcare providers, it's for the patients too. Just remember, wet, lather, scrub, rinse, and dry. 30 seconds. It's the #1 way to prevent infections.